Good morning, everyone. Dr. Mindy Salvino here, board certified naturopathic doctor, registered holistic dental hygienist, and owner of the Pure Health Collective. I wanted to do a video on vitamin K2. So in dentistry, vitamin K2, in biologic dentistry, vitamin K2 is something that is recommended to a lot of patients. And the reason for this is for its anti-decay mechanism. When people have rampant decay, especially for people who have had radiation chemo, that tends to affect your salivary glands. So vitamin K2 is something that's really helpful for many of these people. Just like everything else in our body, our tooth has a lymphatic pump. So think about when you go and you brush your teeth, and you're finished brushing your teeth, your mouth is all minty, and your teeth are smooth and slick feeling. And within 20 or 30 minutes, we start to develop this kind of coating on our teeth. You can feel it. This is what's called an acquired pellicle. And what that means is we have a lymphatic pump inside of our tooth, and it's pumping outward. And that's where that acquired pellicle comes from, is the lymphatic function of our tooth. If we have a lymphatic pump that is not working, instead of pushing outward, pushing the lymph of the tooth outward and creating this acquired pellicle, what happens is it's like the pump gets turned off. And instead of pumping outward, this tooth can actually draw bacteria into itself through the dental tubule. So these are all these tiny little, imagine these little microscopic water slides that go from the outside of your tooth enamel straight down into the tooth. So a tooth is very, very porous. And when our lymphatic pumps, essentially inside the tooth, are not working, instead of pumping outward, they can draw inward. And these are the people that are more prone to rampant and chronic decay, because we're getting a lot of bacteria drawn into the tooth. Vitamin K2 keeps the lymphatic pump of your tooth healthy. So it keeps that outward rotation going, so that the tooth is less likely to draw bacteria into itself and cause chronic decay. If you have had radiation, if you have had issues with your salivary glands, you might check with your medical doctor. I don't know that that's something that I can recommend to people across the board, but speak to your doctor and see if vitamin K2 might be something that's helpful for you, especially when you're dealing with chronic decay.